The 3rd June 2021 International and Domestic Integrated Conference in Korea. My article title is Analysis of Mental Health Influencing Factors of Elderly Males and Females Using Big Data. Introduction. The average life expectancy of the Korean population was 74.9 years old for males and 81.6 years old for females in 2005, and increased to 79.7 years for males and 85.7 years old for females in 2017. And it is estimated that by 2035, the average age will be 80 years old, with 83.7 years old for males and 88.5 years old for females. In 2000, the elderly population entered an aging society with 7.2%, and in 2017, the elderly population exceeded 14% of the total population entering an aged society. In 2020, it is expected to increase to 15.7% in the future, reaching 20.3% in 2025, and Korea is expected to enter an ultra-aging society, expected to be 43.9% in 2050. The elderly are psychologically weakened, and as stress increases, chronic diseases, social life skills, and physical activity problems are accompanied. Previous studies have shown that stress has a high correlation with depression and causes psychological disorders. Other studies have reported that stress is a risk factor for suicidal thoughts in the elderly. In addition, stress has been reported to be closely related to poor quality of life in the elderly, indicating that it is necessary to manage stress in order to improve the health status and quality of life of the elderly. Recently, the importance of males' health has emerged as a materially rich but emotionally dry situation, and depression has been raised as a major social problem. Depression is a psychological change that occurs more in the second half of life than in the first half. In particularly, stress caused by aging is the cause. In addition, the death of the spouse, physical illness, difficulty in economic affairs, feelings of alienation and loneliness, regret for the past years, and other causes increase depression. According to previous studies, depression in the elderly causes an increase in the number of chronic diseases, sleep disorders, activity disorders, and a decrease in quality of life, indicating that depression and quality of life are closely related. Cognitive function refers to the ability to concentrate, the ability to remember, and the ability to speak language. As we get older, our cognitive function decreases, and the risk of dementia increases. When severe depression comes, it leads from despair to suicide. Depression and suicide show a close correlation. Depression in the elderly needs to be managed by seeking attention and effective intervention methods. Study aims. In this study, stress, depression, and suicide plans were analyzed according to general characteristics, health behaviors, and economic conditions in males and females aged 65 years old or older. In addition, depression and suicide plans according to stress were analyzed. Therefore, it is intended to help create a prevention program for the elderly with mental health problems such as stress, depression, and suicide plans, and provide basic data to prepare for a healthy retirement. Research design. This study is a research study to confirm the relationships between depression and suicide planning according to stress recognition of elderly males and females. Research subject. This study targeted the elderly age 65 or older out of a total of 10,453 people who participated in the health survey, screening survey, and nutrition survey in 2018, the third year of the 7th National Health and Nutrition Survey. Among the respondents, 7,992 people participated in at least one of the health survey, screening survey, and nutrition survey, and the participation rate was 76.5%. By survey area, the participation rate of health surveys and screening surveys was 73.2%, and the participation rate of nutrition surveys was 80.1%. Since the nutrition survey is conducted for all household members by visiting households with participating household members, there is a difference in the number of subjects for health survey and medical examination. Research variables. This studied the data for 2018, the third year of the 7th National Health and Nutrition Survey, consists of a health survey, a screening survey, and a nutrition survey. In this study, gender, age, marital status, educational background, residential area, household income level, subjective health status, sleeping hours, economic activity, working type, working hours, alcohol consumption, smoking, stress level, depression diagnosis, suicide plan, physical activity, and absence of breakfast were analyzed. Data collection procedure. This study is a secondary analysis study conducted by integrating raw data from the 7th National Health and Nutrition Survey conducted by the Korea Centers for Disease Control and Prevention. Health surveys and screening survey were conducted at the Mobile Screening Center, and nutrition surveys were conducted by personal visits to the target households. All items of education, economic activity, and Nutrition Survey of the Health Survey were surveyed by interview method, and the areas of health behavior such as smoking and drinking were surveyed by self-reporting. Data analysis method. This study analyzed the data collected by the Health Survey, Screening Survey, and Nutrition Survey in 2018, the third year of the 7th National Health and Nutrition Survey, using the Statistical Analysis Program SPSS 21.0. Research result. The degree of recognition of stress according to general characteristics. Male stress recognition level was 20 in the VHSCG, 72 in HSCG, 351 in the LSCG, and 236 in the VLSCG. Females were VHSCG 33, HSCG 155, LSCG 400, and VLSCG 312. Both males and females appeared in the order of LSCG, VLSCG, HSCG, and VHSCG. The degree of stress recognition of elderly males and females had a significant effect on age and subjective health status. The age, subjective health status, and absence of breakfast showed a statistically significant difference in the degree of stress recognition among the male elderly. The level of stress recognition of elderly females is age, educational background, household income, subjective health status, and economic activity, physical activity showed statistically significant differences. Depression according to general characteristics. Among the male elderly, 23 were diagnosed with depression and 627 were not diagnosed. Of the elderly females, 87 were diagnosed with depression and 900 were not diagnosed with depression, indicating that female seniors were more diagnosed with depression. The degree of depression was analyzed to have a significant effect on subjective health status, physical activity, alcohol, smoking, economic activity, working type, and working hours in both male and female elderly. The degree of depression in the elderly male was statistically significant in the subjective health status, sleep, physical activity, drinking, smoking, economic activity, working type, working hours. The degree of depression in elderly females was subjective health status, physical activity, drinking, smoking, economic activity, working type, and working hours shows statistically significant differences. Suicide planning according to general characteristics. Among the male elderly, 13 suicide plan group and 663 non-suicide plan group. Among the elderly females, 22 people in the suicide plan group and 887 people in the non-suicide plan group. The degree of suicide planning of elderly males showed a statistically significant difference between educational background and employment type. The degree of suicide planning of elderly females showed a statistically significant difference in household income, subjective health status, physical activity, and economic activity. Conclusion. This study is based on data from 2018, the third year of the 7th National Health and Nutrition Survey. The demographic characteristics, health behaviors, and occupational characteristics of 1,653 elderly males and females over 65 years of age were investigated according to stress, depression, and suicide plans. The results of this study are as follows. First, the cognitive levels of stress in 65-year-old males and females were all in the order of LSRG, VLSRG, HSRG, VHSR. The level of stress recognition was analyzed to have a significant effect on age and subjective health status in both males and females, and the level of stress recognition of the elderly males shows statistically significant differences in age, subjective health status, and absence of breakfast. The age, educational background, household income, subjective health status, economic activity, and physical activity show statistically significant differences in the level of stress recognition among the elderly females. Second, it was analyzed that the degree of depression had a significant effect on subjective health status, physical activity, alcohol consumption, smoking, economic activity, working type, and working hours in both 65-year-old males and females. The rate of depression diagnosis was higher in female seniors than male seniors. The degree of depression of the male elderly showed statistically significant differences in subjective health status, sleep, physical activity, alcohol consumption, smoking, economic activity, working type, and working hours. The degree of depression of elderly females shows statistically significant differences in subjective health status, physical activity, alcohol consumption, smoking, economic activity, working type, and working hour. Third, it was found that the degree of suicide planning of elderly males showed statistically significant differences in academic background and employment type. The degree of suicide planning of elderly females showed statistically significant differences in household income, subjective health status, physical activity, and economic activity. Fourth, as a result of analyzing the relationship between depression and suicide in 4 groups according to the level of stress recognition, the results of depression and suicide planning showed statistically significant results. In other words, it was found that the higher the level of stress recognition, the higher the depression and suicide plans. The following suggestions are made based on the results of this study. First, there is a need for continuous research and attention on factors influencing stress recognition, depression, and suicide according to the general characteristics of elderly males and females. Second, there is a need for follow-up studies on depression and suicide according to stress recognition of elderly males and females. Third, research and interest in the development and application of intervention programs to solve the mental health related problems of the elderly males and females will be needed. Thank you for listening.